Hi, everybody, and welcome back to my channel. Today we're going to do something a little bit different. I'm going to show you what I've learned and from whom, and a great doctor, all the stuff I talk about how your brainstem damage can cause all sorts of dysfunction in your body, right? So today I'm going to show you where I get this from. There are some really amazing doctors out there, neurosurgeons, like Dr. Frazier Henderson, who is one of the most published neurosurgeons in North America, if not the world. He's been doing this for many years. And in this video, I'm going to review one of his videos to make it a little easier to understand because, when he's talking to the audience in these presentations he puts on, it's to people who kind of already know about this stuff already. So to somebody who's new to it, it's a little bit difficult to understand. So I kind of simplified it, okay? It's all information that's in the video. I haven't changed anything. I just might have excluded some of the surgery stuff and some of the medication stuff because I don't know a lot about that stuff. I just really focus on the structure of the nervous system and how physical damage or poison, right? Medications, bad food uh, can harm your nerves and cause all sorts of dysautonomia. So let's get started. So the video I'm going to review uh, was a presentation done. It's called Autonomic Nervous System Dysfunction. And equals dysautonomia, and it's a relationship to craniocervical instability. That's instability at the top of your neck. So it's a simple review of Dr. Frazier Henderson's 2019 presentation at the Global Learning Conference in Nashville. You can find it on YouTube. It was put on by the Ehlers-Danlos Society. So there's the link, and let's get started. So the autonomic nervous system controls all of the actions of the body that you don't think about, like cerebral circulation, cardiac function. Cerebral circulation is up here. Cardiac function, baroreceptors and blood pressure, kidney blood flow, gastrointestinal function, all of it. Pulmonary secretions, airway resistance, blood flow to the skin, temperature regulation. There's lots more that it controls, okay? Here's a little diagram of some of the actions of our parasympathetics and our sympathetic nervous system. So the brains, let's say, of the rest and digest is the parasympathetics, is up here at on the brainstem, and also they have cell bodies down lower in the sacral region. Whereas in the sympathetics, the cell bodies, so the brains of those nerves, are anterior to the T-spine. So they're between like T1 and T12. Okay, so depending on which part of the spine, so let's say the parasympathetics, your rest and digest, constricts your pupils, increases saliva production, reduces the heart rate. So if you have a heart rate issue, could be because there's damage to that guy. You go to the other side, your sympathetic, your fight or flight nervous system. Remember, they have to be in balance, right? So when you need to run from the lion, he dilates your pupils, he inhibits saliva production, he dilates your bronchi so you can take a lot more air in, and he rises the heart rate, right? So if you have a lot of heart palpitations or uh, fluctuating heart rate, things like that, it could be because there's a little bit of damage somewhere in here. Yes, so stimulates the activity of the digestive organs. That's the rest and digest part of the nervous system. So if there's damage to that one, you could have problems anywhere in your digestive tract, from the sphincters not closing, all through your digestive tract, not just your esophageal. You have ones in between your colon, your large colon, and your small intestine. You have one between your stomach and your small intestine. So plus the motility of the food going through, all that stuff. Now, The other side of it, the sympathetics, the fight or flight, inhibits the activity of the digestive organs. So if you're not in balance, one of these two is getting damaged, you can have dysfunction anywhere in your bowel, which is a very common thing nowadays. It's not just about the food you eat, because some people can eat not very good. And if they have no damage to their nerves, they function fine. But if you have chronic diarrhea or chronic constipation, or you bloat, or you feel full easy, these can all be neurological issues. Constricts urinary bladder, that's the parasympathetic. So if he's not working good, you might be incontinent, or you might not be able to hold your pee. Um, Anyways, I'll let you look at that. So the autonomic control of cardiac function. Sympathetics increase blood flow. Yeah, because you got to run from the line. Play a role in the SA and AV nodes to speed up ventricular contraction. So if there's damage anywhere along those nerves, you can have trouble with any of that. The parasympathetics, vagus nerve, which remember comes out of your brain right out behind your ear here in front of C1. So your vagus nerve slows down heart rate and heartbeat and flow, okay? Because you're in the rest and digest now. Autonomic function of airways. So parasympathetics control mucus production. If you have a lot of mucus, you could have a problem with a nerve, and constricts airways, asthma type symptoms. So sympathetics dilate the airways because they want you to be able to take in a lot of air so you can run from that lion. Parasympathetics control GI tract and all functions, mainly vagus nerve and cell bodies at C1 and 2, along with cranial nerves 9 and 12. And salivary glands, production of gastric juices and enzymes. So if you're not digesting something properly, or you can't take certain foods, it might be because you're not producing enough of this. Also stimulates your gallbladder. I know so many people that have to have their gallbladders removed because they're not functioning properly. I don't know. And there's not many answers for this, but when you really learn about the structures of the nervous system and where they can easily get damaged and what they control, you will understand. And this is all Dr. Frazier Henderson saying this. I'm just reviewing it for you. So control of the lower GI system is controlled by vagus nerve and its cell bodies at S2 to S5. It stimulates gastric emptying, contraction of bowel, blood flow to bowel. So if the blood flow is not getting to the bowel, what's going to happen? You're not digesting properly. Contraction of the bowel. So if it's not moving, you might get compacted and have constipation. Stimulates gastric emptying if your food sits in there forever, right? Sympathetics, increase adrenaline. Okay, so increased adrenaline will cause decreased blood flow to the bowel, decreased contractions, cause gastroparesis, which is like paralysis of the stomach functions, cause increased diarrhea and constipation, dysautonomia of the GI system. So you can also get dysphagia, trouble swallowing, increased gag reflex, choking with liquids and bringing food back up, gastric reflux or acid reflux. These are all dysfunctions of the digestive tract that you can have that can be caused by nerves. Gastroparesis, delayed emptying of the stomach contents, causing nausea, bloating, feeling of fullness after eating small amount, malabsorption, right? Constipation, IBS, colitis, bowel incontinence. Like, I don't know, you ever heard your doctors tell you about this? No, you haven't, because they don't know. They just treat the symptoms. Yes, we know food helps, right? Proper food and exercise helps everything, but you cannot exclude this information because sometimes even food and exercise doesn't do it for you. And I don't believe you can really diagnose anything in the body without looking at this, because once you start doing this, you will understand that most of the time, all of these problems are neurological. Raynaud's, so vasospasm of blood vessels to the skin. So you have cold hands and feet, right? Some people have it really bad. Some people It comes and goes too. Abnormal autonomic function of blood flow to the skin in response to cold and stress. Raynaud's, POTS, postural orthostatic tachycardia syndrome. It is a dysautonomia. It's a dysfunction of the blood flow to your brain, causing you to get dizzy and sometimes pass out because the signal's not getting to your heart to pump the blood up. It is very common. POTS is common in craniocervical instability and Chiari. Now, if you've been on my channel, Telegram, you've seen me talk about Chiari. Chiari is described as a couple of different things. But basically, it's about your brainstem in the foramen magnum. You know, you have a big hole at the bottom of your skull. Your brain turns into a brainstem. So your big brain turns into a brainstem. And the brainstem is thicker than this hole. So when it descends too much because of instability, or you've had a car accident, or you're sitting all day like this, you're basically pulling your brain out of your head. So your brainstem descends and plugs the hole. There's also cerebral spinal fluid that has to go around there. There's a lot of different things that can happen, but it's all basically the same problem. So Chiari is the problem with Chiari is that it can affect your brainstem, and your cerebellar tonsils also descend in there, which is your cerebellum has a lot to do with your balance, and they believe that that's what causes Parkinson's damage to it. So you'll hear it called as Chiari. You can hear it as crowding of the foramen magnum, tonsillar ectopia. It's basically the same thing. Now, for some people, it's because their back of their head is very flat. There's not a lot of room there. So the brainstem wants to just descend. It gets pushed down. What else causes Chiari? Tethered cord. When the bottom of your spinal cord can be stuck, so there's not a lot of up and down movement at the bottom, you stick it right there and then you bend over like this all day, you can actually pull. There's a translation that ends up all the way from down there to here, and that's kind of how butt-thorax works. So Chiari is more common in connective tissue disorders. So if you're hypermobile, very stretchy, you're very flexible or double jointed. If you have instability in some of your joints, you can also have instability or hypermobility. Your connective tissue is too stretchy. It's not strong enough. So there's too much movement in these joints. You are more likely to suffer these disorders of the brainstem, depending on what you do in life. Like if you're sitting at a desk, if you stay weak, if you don't ever exercise, and you have weak joints up here and you're always doing this, or you had a car accident, you are more likely, because you're hypermobile, to have deformation of the brainstem. So Chiari is more common most common symptom in EDS. So remember, EDS is Ehlers-Danlos syndrome. I don't like to call it that. Now, I'm not downgrading how serious EDS can be, because those people are very hypermobile and they suffer a lot. But I like to call it the very top of the hypermobility spectrum. And depending on how high, if you're at the bottom of the spectrum, you might have not too many of these neurological issues we're going to talk about today. But if you're at the top, you're as hypermobile as can be, you are the type of person that's going to suffer a lot. And it is Chiari, the damage to the brainstem, is the most common symptom in EDS, the top of the hypermobility spectrum. There is an increased level of adrenal and sympathetic tone, impaired ability to respond to hypotension, no vasoconstrict when getting up. So your blood vessels, the little muscles around, aren't getting the signal to close. Okay, and your sympathetics and your parasympathetics control that. No vasoconstrict, so when you get up, it doesn't push the blood up. Problem of a sympathetic, not parasympathetic system. So it's a problem of the sympathetic. So remember, they also have parts that come out in front of the neck there. So If the signal is not getting through to those small muscles around your blood vessels to constrict, then they're not going to. That's because there's too much movement up here. Cause of dysautonomia. Okay, trauma to the CNS, the central nervous system, which is the brain, brainstem, and spinal cord. Hypermobility spectrum disorders. These are the causes of dysautonomia. And hypermobility spectrum disorders because of the instability that goes along with it. And brainstem deformity conditions like Chiari, basilar invagination. It's all different ways of damaging the brainstem because it's being pulled down a little bit, or it's not sitting right at the bottom of your head. Where is dysautonomia? Autonomic impairment is multifactorial, involves brain, brainstem, spinal cord, peripheral nerves, which include cranial nerves. Also, nuclei, plexi, parasympathetic and sympathetic systems, the whole nervous system, from top to bottom. Every aspect of the nervous system, from brain to small nerves in the skin, they are all literally connected. They are. So the hypothesis, so they did some research, Dr. Frazier Henderson, you can go on the video and see about his research that they did. I don't think they had finished the paper yet, but it was, they show their findings of it before it got published. So his hypothesis is biomechanical deformity of the cranial cervical junction alters autonomic activity. Do you get what that means? Biomechanical deformation of the brainstem and upper spinal cord junction alters autonomic activity, meaning anything below here can be dysfunctional. It's not just going to cause you pain. It can be anything, depending where it's being damaged. Any of those nerve signals aren't getting through to your target organs, your bladder, your GI, anything, and they will not function well. So it's not necessarily taking pills to make it better. It's about fixing this. This is the root of most of these problems. So what causes biomechanical deformity of the brainstem? Structural Chiari, basilar invagination. So Chiari is your brainstem kind of sliding down into the foramen magnum where it does not belong. Basilar invagination is where, if you look at C1, C2, C2 has a bit of an odontoid, a little point, and that's how it joins on to C1. But when it's being pulled down or there's a certain bad curve in your neck, you can actually poke the brainstem from the front with C2, the odontoid of C2. That's basilar invagination. Or, so what causes biomechanical deformity of the brainstem? Structural, Chiari, basilar invagination, irregular curve of the neck. Dynamic, meaning in movement. Instability between C0 and C1 and C1, C2. C0, C1 is your head sitting on C1, C2, C1, C2 is C1, C2. Why does deformation of the CNS alter neurological function? Dr. Henderson discovered Dr. Henderson discovered axon retraction balls as a result of overstretching and straining of the brainstem. Stretching neurons leads to dissolution of the architectural elements of an axon. So it's basically killing the axon, the nerve. Stretching of 20%, they did studies, in, of course, with animals, but they stretched 20% of the nerve length, and what they discovered was that the axons died. It caused death to the axon, apoptosis. Premature apoptosis. And then after observing the nerves, he found these axon retraction balls. So he was one of the discoverers of this. And that wasn't too long ago, I believe. So overstretching of the spinal cord or the brainstem can cause death to the nerves. Your brainstem is a lot of tracts. It turns into a cable, right? Your brain turns into a cable. Your brain turns into billions of tracts. And depending if you're pushing on it or it's being pushed from the front or where it's being damaged, the affected organs will be affected. The nerve signals won't get through, or they can't get back up, along with blood flow and cerebral spinal fluid flow. So stretching neurons leads to dissolution of architectural elements of the axon. Stretching 20% will cause early death to the nerves. Overstretching of nerves causes alteration of flux of sodium through the nerve, which maintains the electrical chemical gradient. So overstretching of the nerves over time, those signals just can't make it, right? Or you get overstimulated or just not getting through. Stretching is an epigenetic stimuli. It can cause changes in the way your genes work. Overstretching. So I can't remember how much, like when you're doing this once in a while, that's okay, it's normal. But if you're like this all day, you could be overstretching your brainstem and the top of your spinal cord. And over time, all of a sudden you have acid reflux and headaches and all these other things. And it could be because of that. Example, patient of Dr. Henderson, young boy was admitted multiple times to hospital. He would stop breathing at times and his heart would stop for brief periods. After they corrected his instability in his neck from surgery, it all stopped. It was due to damage to his brainstem because of instability in his neck. Now that's pretty serious brainstem issues. There's actually a young lady a couple of years ago, can't remember her name. I follow a lot of young people with Ehlers-Danlos, and they're online on YouTube. I cannot remember her name, but she was suffering a lot. She had Ehlers-Danlos, and at the end, she actually died. A young woman, I believe she was in her early 20s. And the last couple of weeks of her life, that's what happened to her. Her heart would stop, or she'd stop breathing all of a sudden. They didn't know why. This is so common in people like them, the top of the hypermobility spectrum. It's unbelievable. But there's great information out there. It's just not everybody knows about it. She probably could have used neck surgery. Okay, so after surgery, this young man, it's his damage stopped. So he didn't have the stop. His heart didn't stop anymore. Stopped breathing. That's pretty serious stuff. Symptoms of cervical medullary syndrome. So that's your medulla. So that's your brainstem, let's just say. Symptoms of damage to your brainstem, okay? Watch this. Headaches at the back of the head. Now, I told you I was gonna do something about headaches at the back of the head. We're talking about Chiari here and brainstem issues. So it could be because the brainstem actually is getting pinged, or it could also be because of cerebral spinal fluid being plugged in the hole too. Because remember, around the brainstem, around the brain, and through the chambers inside the brain, the cerebral spinal fluid has to flow, and it flows on the outside. So if you're doing this, you're going to block flow somewhere to cerebral spinal fluid, and that can cause a lot of different things. But often you start with a headache at the back of the head, and it refers a lot to the back of the eyes. So headache at the back of the head, dizziness, arm weakness, numbness, pain, poor balance, trouble sleeping, memory problems, Raynaud's, cold hands and feet, tachycardia, hot, standing up and feeling dizzy, leg numbness, vision problems, blurry, vertigo, urinary problems, IBS. These are just some of the symptoms, okay? Usual symptoms found in people suffering from cervical instability. Okay, anxiety, headaches, dizziness, arm weakness, pain, numbness, trouble sleeping, sleep apnea, memory problems, poor balance, Raynaud's, POTS, nausea, bloating, GERD, diarrhea, abdominal pain, exercise intolerance. That is, you have a big day, you do a lot in one day, and it takes you 3 or 4 days to recover. A lot of people that have that. It's an actual thing. It's real. I know you can't see it and you find people are lazy. No, they are not lazy. They feel terrible after overdoing it. Even young people. So exercise intolerance, fatigue, muscle pain, night sweats, heat intolerance, night sweats. I'm 54, so I don't get them. It's very rare. Um, it's funny because I get them when I turn around in bed once in a while, so it's positional. I know that's what it is. It's due to my neck or the way I'm laying. heat intolerance, hearing problems, tinnitus, speech problems, urinary incontinence. A lot of women suffer from that. And men as well, mostly women, frequent peeing at night. That's a men one. I help people with that now. It's a nerve thing. I can prove it because I help them. I know they look at me and go, they don't think so, right? Because doctor's just going to say, even without looking at it, it's your prostate, fix your prostate. I'll give you some pills. That doesn't work. What I do works because I target certain areas in the spine and I work on that, and that's how I help them. So again, these are, what are these again? Usual symptoms found in people suffering from cranial cervical instability. Now, I believe I got all these because they did a survey. Dr. Henderson did a survey, and these are the frequent things that people suffer from that have damage to the brainstem due to unstable joints in your neck. Okay, so let's get back. Fatigue, exercise intolerance, fatigue, muscle pain, night sweats, heat intolerance, hearing problems, tinnitus, can also be fluid feeling, itchy ears, speech problems, urinary incontinence, frequency peeing, night peeing, urgency. You can't even hold your pee. All those can be neuro problems. Tremors, sexual dysfunction. For men, we always think it's a heart problem, and no. If you're having dysfunction, it's probably because the nerves, you probably have a low back issue. Because the bottom of your spinal cord has the parasympathetic cell bodies there. So often low back chronic issues deal with one, two, or three of these. Urinary problems, bowel issues, and reproductive issues, reproductive system issues, because the low back is where the brain's a lot of the function comes from. Okay, but also it can come from here. So tremors, sexual dysfunction, uneven pupils, large pupils. Some people have a aversion to light, right? I never wear sunglasses. I'm fine. But a lot of people have hypersensitivity to light, so you need to wear sunglasses. If ever you see uneven pupils on somebody, that's pretty serious too. That's neurological. Heart palpitations. A lot of people have those. A lot of young people in my clinic have those that I see. Difficulty breathing, asthma type symptoms. Might not be asthma. Remember, your nerves control the flow of air in and out. And if something's not working and you're getting constriction, you can have asthma type symptoms. So yes, certain things trigger it, but is the answer always taking a pump? What if you fix this? You might be able to get rid of your problems. Oh, there's exercise intolerant. Abnormal vision, blurry vision, floaters. These are all neurological and associated to problems up here. Brain fog. So indications for atlantoaxial fusion. Headache at the back of the head often radiates to behind the eyes, often called occipital neuralgia. Neck pain, visual changes, tunnel vision, loss of peripheral vision, blurry vision, tendency to walk into door frames. You know, a lot of people are clumsy, eh? Syncope or pre-syncope, that's feeling lightheaded and something like POTS too. Hyperreflexia, hypoesthesia, pinprick test with no pain. So the neurologist may prick you with a needle. You might feel the pressure, but you won't feel the pain. That indicates a problem up here. Hyperreflexia. If any of you have ever been to a neurologist and your reflexes, they check your reflexes. Obviously, having low or no reflexes means something, but hyperreflexia, meaning if the neurologist uh, tests a reflex on your knee and you almost kick him, that means you went too far, right? That's not a normal, you're just supposed to jolt a little bit. But if you almost kicked the guy, that's hyperreflexia. That means something too. That means something, upper motor neuron injury. So often people that need surgery, they'll have tenderness at C1, C2. Atlantoaxial instability by CT scan or MRI by stressing the alar ligament, thus turning the head to the left and right. So what they will do, they'll lay you down in a CT scan or an MRI, and instead of just laying flat like that, they're gonna take one like that, where you're turned all the way to the right and all the way to the left. Now, most hospitals and scanning centers don't do that, they just do the usual, right? That's why they miss a lot of this stuff. There is also such a thing called an upright MRI, which is even better, because when you're under pressure here, you usually have your pain when you're sitting or standing, not when you're laying down, when you have most of your problems. So when you're upright, you would get a true sense of how much when you're laying down, you wouldn't get the sense of how your brainstem has descended into the foramen magnum. But they do have sit-stand MRIs, and they should be in every hospital if you ask me. I will do a video on that one day. A lot of people don't know they exist. We have DMX X-rays too, where you can bend like this, and they can actually see the instability in your joints. They can see what's getting banged around, and that's what they say now. To see, this is Dr. John Baird, I'm quoting him. To see is to diagnose, to not see is to guess. That is what's going on in medicine today. Seriously, I've done enough research on this, and again, I see it all the time. I am helping people with a lot of these neurological issues. Obviously, some people are going to need surgery, but there are other options. And if you know about your really taking care of your neck and your posture, remember, I think your core is down the center, like an apple core, not your stomach. You really want to keep your whole spine strong because it's your nervous system. It's protecting your nervous system. Yeah, so symptoms improved after surgery: POTS, exercise intolerance, headache, lightheaded, gastroparesis, trouble breathing, bowel incontinence, asthma-like symptoms, colitis, unequal pupils, enlarged pupils, Raynaud's, chronic regional pain. Some people have pain all over. You ever heard of fibromyalgia? Guess what? That's chronic regional pain. There is significant improvement in dysautonomia symptoms after correction of deformity and stabilization. Conclusion of Dr. Frazier Henderson and his research. The autonomic nervous system is anatomically ubiquitous throughout the body. Dysautonomia occurs frequently with connective tissue disorders, and that's an understatement, he says. Dysautonomia is strongly associated with conditions of instability and deformation of the brainstem and upper spinal cord. Dysautonomia shows improvement after reduction of deformity and stabilization surgery. So yes, but he'll also tell you, oh, I'll wait till the questions here. When should you seek out a surgeon? The neurosurgeon. These are questions that were asked after at the end there that Dr. Frazier Henderson answered. When should you seek out a surgeon? The neurosurgeon should be the last resort. Should try physical therapy and other therapies first. Now, again, a lot of people can be helped if they know what the problem is or where the problem is. And specific exercises for you, because not every exercise is good for everybody. And depending on how much instability is in there, there's also prolotherapy where, like Dr. Frazier Henderson, Dr. Ross Hauser, that I talk about a lot from Caring Medical, he performs prolotherapy. So he will scan you and do all the testing and see where the instability is. And then they will do posture correction exercises. And then after, they got you where they want you, they're going to inject your ligaments that are too stretchy and weak. And they're going to inject them with a substance that will actually cause them to stiffen up, so that your ligaments can hold the joints better, and a lot of people get better after that. So there's a lot of other options if you know. Okay, that's why I wanted to do this, because I know I talk a lot about this stuff, but really, what do I know? I'm just a massage therapist. Well, guess what? I know a lot more than most doctors now after 2.5 years of this. My clients are seeing a lot of improvement in not just pain, but other dysautonomia, POTS, all sorts of things. So it's very exciting for me. I love it. And I want to spread this knowledge. So that's why I've started these videos. Okay, when you seek out a surgeon, yeah. The other question was, which is funny because one of my clients was diagnosed with Chiari. And she she doesn't have the typical headaches or anything. It was her hearing and her vision that changed. So now she's wearing hearing aids. She's 60. She's not very old, but she's got a really bad curve. Like she's got an overcurved neck and an overcurved upper back. Um, so the doctor told her hearing has nothing to do with Chiari. And see, that's her doctor doesn't even know much about this stuff. I think what he told her at the beginning was to, well, I'm not familiar with Chiari too much, so we're going to learn about this together. Like these are doctors. I mean, I don't expect them to know everything, but they don't know anything about this stuff. It's hard to believe, but that's why these great doctors are putting out these presentations. If only everybody would listen to them. Okay, what was the other one? Another question was, what can I ask my neurologist to look for? He says flexion extension, CT or MRI. So there's another way to test for Chiari. Instead of just laying you down flat, if you don't have an upright MRI, you can put a pillow under your shoulders, which will extend your neck, or put a pillow under your head, and which will bring your head forward when you're laying flat on your back. Well, that's another way to do an MRI or CT scan if you don't have the upright MRIs. And it's to rule out instability of C1, C2, turn your head fully to the right and left to stress the alar ligament. Is surgery improved? Is hearing improved after stabilization surgery? Stabilization surgery. Yes, I haven't looked at that specifically, but many patients have better hearing caused by overstretching of nerves. So that's the end. Sorry, I hope it's not too long. This is really simple stuff, and I'm going to keep putting it out there until somebody catches it. Actually, I have I learned from Dr. Frazier Henderson and a lot of his colleagues, and I have a meeting coming up with one of his colleagues, a top neurosurgeon in North America that wants to talk to me about my anecdotal findings in orthotics and how I believe it is associated with tethered cord and relief, how to fix it. So pretty exciting stuff. We were supposed to have that meeting yesterday, but because of surgery, she had to postpone it. So as soon as I get that, I'm going to be talking about it. So, but anyways, remember, keep your neck healthy, stop looking down at your phone, and stay tuned, like and subscribe. Look at the symptoms on this thing. How many people do you know suffer this stuff? It's crazy. Nobody knows what's going on. It's freaking simple, okay? It's all about your neck. Okay, so thank you very much. So don't forget, you can watch the video and we'll talk to you soon.